My name is Mac Norton. I'm an IT technician currently. In the past, I was an electronic technician in the U.S. Navy, and I worked on communications equipment and radar. It was just a lot of physical things I had to do, and there started some back pain there, and it never really went away. It would only get worse with the jobs as they changed. And eventually I worked at a job where I was doing deliveries. During that time, it was getting way worse than I've ever experienced, to the point where it would stay with me for days after I do heavy lifting. There was an isolated incident. I ended up getting hurt for real, and it was a full herniation in my sciatic nerve. It was just like overnight, I had to have assistance getting out of bed. I learned through all this that I value myself based off of what I'm able to do for those I care about. I recall a time when my mom dropped something on the floor in front of me, and it crushed me that I couldn't bend over and pick that up for her. When I got to the point where I could no longer do anything for those I care about, I just felt like it was in the way. I felt like I was just a burden for people, and that led me down a pretty dark path. The workers' comp process and realizing that I'm not getting better had a really detrimental effect on my mental health. Countless physical therapy sessions, needle treatments that they tried. And when I got to Dr. Bundy, it was after I demanded an MRI.
Mac is an interesting story. He was a workman's comp injury patient that I ended up doing a microdiscectomy on him. He had been suffering for a couple of years. He had just a little bit of multifidus atrophy.
After the first surgery, it took a while to recover. I still felt the pain. That was when Dr. Bundy recommended ReActiv8.
I knew as soon as that I'd learned about ReActiv8, this was the surgery for him. His physical exam findings were those that they had used in their clinical studies. That's what really drove me to recommend this for him.
When I realized there was options, it lighted that fire in me that I wanted to keep fighting. I had hope. I had to go for it.
Mac's probably had his device in for almost 2 years, and he's pain-free. It's completely changed his life.
Since I started using ReActiv8, I was able to start doing things for myself again. I was able to start doing my own yard work again. I was able to walk longer, stand longer. I finally had that support that I needed on that surgery site. I like to host cookouts for my friends during the summer season. I'm able to, do those things again. I'm able to ride my bike again. I've been on hikes. I mean, it's amazing how much I'm able to walk and do. To someone who isn't sure if ReActiv8 is right for them, I would say the question really is, do you want your life back? It's truly incredible just how much of a difference it's made.
Anybody that comes in with chronic low back pain should have a multifidus test. There's no question that we know that causes back pain, and we now have a cure for that. Restorative neurostimulation is just beginning. This is something that is changing patients' lives, and I think is really, truly going to revolutionize the way we treat chronic low back pain.